Assalamualaikum and hi everyone. Today my team and I will be presenting on the topic the challenges of speaking in English in the world among nursing students in Malaysia. Before I start, I would like to introduce my team member.
Hello, my name is Nur Ali Atira.
My name is Nur Emilia binti Zaidi.
My name is Nur Ainafika binti Abdul Qais.
My name is Hafizatun Najwa binti Khairul Azri.
Siti Zulaika binti Hasan. My name is Putri Dani Kisana binti Azwan. My name is Nur Izzati binti Zalmi.
My name is Nurul Shazwani Elisa binti Muhammad Rasul.
So now I will start with the introduction of our study. In Malaysia, English is our second language. Also, we have learned English in school. Not all students feel confident using it, especially in clinical setting. In hospital, we meet patients from different backgrounds. So, English is often used as a common language for communication. In the nursing profession, effective communication is very important. During clinical practice in the ward, we need communicate with doctor, pharmacy, physiotherapy, patient and their family member. We also need explain procedure, take patient history, report patient condition, and most of these tasks require us to use English. However, many nursing students still face challenge when speaking English in real clinical situation. Some may feel nervous, lack confidence, or be afraid of making mistakes. This can affect their ability to communicate clearly and professionally. Therefore, the purpose of this study is to explore and identify the challenge faced by nursing students when speaking in English in the ward. This study is important because effective communication is essential to ensure patient safety and improve the quality of nursing care. That's all for me for the introduction. Now, I would like to pass it to Ain.
So, for background of study, this study examines the significance of English proficiency among nursing students within the Malaysian healthcare context. English functions as a global medium for education and professional communication, particularly in healthcare where it is essential for medical terminology, documentation, and interdisciplinary collaboration. Although Malaysia is commonly used in local patient interactions, English remains crucial in ward settings, clinical documentation, and communication with diverse patient populations, including international patients. However, previous studies indicate that many nursing students experience challenges such as communication anxiety, limited vocabulary, and low confidence when using English in clinical practice. These barriers may negatively impact clinical performance and quality of patient care. Therefore, strengthening English communication skills is vital for professional development and safe nursing practice. Next, I will pass to Alia Atira.
Next, I will present about problem statement. Clear English communication is essential for Malaysian nursing students to deliver safe and effective patient care. But many struggle with limited vocabulary, low confidence, and anxiety during ward practice, which can lead to misunderstanding. Research on this challenge remains limited, prompting this study to explore their difficulty to speak English in clinical setting. Next, I will pass to the next member.
Okay, so in this section, I will explain the research objective that guide our study. 1. To identify the factors that contribute to the difficulties to speak in English among nursing students in the world. Second, to identify the common challenge faced by nursing students when speaking English during clinical practice in the world. And third, to explore how challenges in speaking English affect nursing student communication with patient and healthcare staff. Okay, next. 2.3. Now let's look at the research question of the study. 1. What are the factors that contribute to the difficulties to speak in English among nursing students in the ward? 10. What challenge do nursing students face when speaking English in the ward during clinical practice? And lastly, how do challenge in speaking English affect nursing student communication with patient and healthcare professional? Next, member.
Next, for the literature review, nursing students encounter multiple challenges in speaking English during clinical practice. Although they may have basic proficiency, many struggle with nursing and medical terminology which can affect the accuracy of patient communication. Fear of negative evaluation from senior nurses or doctors often increases anxiety and discourage them from speaking English. In addition, limited opportunities to practice, especially when Bahasa Malaysia is commonly used in the ward, will reduce their confidence. The stressful and fast-paced clinical environment further impacts their ability to communicate effectively, ultimately affecting their learning experience and patient care. Next, I will pass to Zulaika.
Now, I will explain the significance of my study and why it is important. English plays a very important role in clinical practice. Nursing students need good spoken English to communicate clearly with patients, family, and other healthcare professionals. If communication is not clear, it can lead to misunderstanding and may affect patient safety. However, many nursing students face difficulty in speaking English. Some have limited vocabulary, low confidence, and feel unsure when using medical terms. Because of this, they may feel anxious during clinical placement. Language barriers can reduce student participation and affect their learning experience. Therefore, improving spoken English skill is very important to help nursing students become more confident and better prepared for real clinical practice. That is why this study focuses on improving spoken English skill among nursing students to enhance their communication, confidence, and readiness for clinical work. Now I will pass to Najwa. Okay, for the chapter 3, which is the research methodology, I will explain about the research design and sources of data in the study. First, for the research design, the study used a qualitative library research design. According to Alima and Suharyanto, this method focused on reviewing and analyzing existing literature instead of conducting survey or experiments. The purpose of using this design was to explore the challenges faced by nursing students in speaking English during clinical practice, especially in the ward setting. This study aimed to identify common communication difficulties and factors affecting students' confidence when interacting with patients and healthcare staff, as discussed by Arayani. By using library research, the researcher was able to gain a deeper understanding of the issue based on previous studies, professional discussion, and academic findings. So for the sources, next. Next. Okay, for the sources of data, this study collected information from various academic and credible sources. These include peer-reviewed journal articles, academic books, conference papers, and healthcare-related reports. Online databases such as Google Scholar, Science Direct, and institutional library portals were used to search for relevant materials. The selected literature mainly focus on English communication in nursing education, clinical communication barrier, and language challenges among nursing students. Previous studies have shown that non-native English speakers often experience communication difficulties in clinical practice, which may affect effective patient interaction. To ensure the relevance
and accuracy of the study, sources published between 2050 and 2024 were prioritized. This allowed the researcher to include both recent development and foundational knowledge. Now I will pass to Put. Thank you.
Next, I will explain the inclusion and exclusion criteria used in this study. To ensure the relevance and quality of the review material, several criteria were applied. For the inclusion criteria, only source published in English was selected. The article had to be peer-reviewed academic publication to ensure credibility. In addition, the study must be related to nursing student and English communication. Lastly, only articles published between 2015 and 2024 were included to ensure the information is current and up to date. For the exclusion criteria, non-academic sources such as blogs and personal websites were not included. Articles without full text availability were also excluded. Furthermore, literature unrelated to healthcare education or clinical setting was removed. By applying this criteria, the study ensured that only reliable and relevant sources were included. So I will pass to Arne.
So next, for data collection procedure, this study employed a systematic literature-based data collection approach. 11 keywords were first identified to this search strategy. A comprehensive search was conducted in the academic database and institutional library resources. The ratified articles were screened based on titles and abstract to ensure relevance to the research objective. Selected studies underwent detailed review. Finally, the literature was categorized into thematic areas to identify recurring patterns and research gaps concerning English communication challenges in clinical setting. Pass to Izati.
So next, for data analysis strategy, this study applied thematic analysis to interpret the collected literature. Each source was carefully reviewed and categorized based on recurring themes such as lack of confidence when speaking English, fear of making mistakes, limited medical vocabulary, communication anxiety, and environmental factors in clinical settings. These themes reflect commonly reported linguistic and psychological challenges associated with English speaking skills in clinical practice. This approach allows the researchers to compare findings from different studies and develop a clear understanding of the communication challenge experienced by nursing students in Malaysia. Next, I will pass to the next members.
Next is ethical consideration. When we talk about ethical consideration, the first thing is informed consent. This just means that students join the study because they want to and they understand what it's about. Then, we have confidentiality and privacy. We need to keep student information private so no one feel embarrassed talking about their English skill. And then, avoiding harm is also very important. Miscommunication can affect patient safety, so we have to be careful. Malaysia is very diverse, so cultural sensitivity matter. We need to respect different language and culture. Lastly is professionally responsibility. Nurse and student must communicate clearly and it's okay to ask for help when needed. These are the main ethical points we need to keep in mind when studying communication challenge in the ward. That's all for me.
Okay, so lastly, for a summary, this chapter outlined the methodology used in this library-based study on the challenges of speaking English in the ward among nursing students in Malaysia. The research design, data source, selection criteria, collection procedures, and analysis method were carefully structured to support a comprehensive and ethical review of the literature. Overall, this method enabled the researchers to synthesize the main findings and present a clear understanding of the communication barriers faced by nursing students in clinical settings.
So this is our reference. So that's all from us from group 3. Thank you.